Welcome. This is a simple user guide for the EVAC Chair 900, American's current stair chair model. This quick video will show some of the key features and best practices for operating the stair chair. It is important to familiarize yourself with this piece of equipment prior to use in the field. And check the battery level. The main power switch is located on the underside of the chair beneath the battery. Turn this on prior to arriving to your patient. The main power may be left on during your shift. Just remember to monitor the battery life. When you arrive to the patient, make sure to lock the wheels prior to assisting the patient to a sitting position on the chair. The chair rolls easily, so it is important to maintain control of the chair while they are sitting. Once the patient is seated, secure them to the chair using the seat belt harness and tighten the straps until they are snug. Then lower the arm rests for the patient. Release the track system on the back of the stair chair when you are at the stairs. The control panel is located on the top bar of the chair. The power button will turn the device on or off as long as the main power is switched on. The green circled arrow facing the crew member is for going up the stairs, and the blue circled arrow facing the patient is for going down the stairs. The plus and minus buttons control the speed of the tracks. Always start at a lower speed setting. Once the patient is sitting and secured to the stair chair, wheel them to the edge of the stairs. Press the power button on the control panel. Extend the top bar by depressing the red bar and pulling up on the top bar. Extend it to a comfortable height for the user. Have your partner extend the two handles near the footrest by pressing the red button and extending the handles. The stair chair requires two people to operate the device when going up or down stairs. While operating the device on the stairs, both crew members need to keep both hands on the stair chair with a secure grip. Before you ascend or descend the stairs, make sure the stair chair is in the center of the stairwell. Once you are in the correct position, tilt the stair chair backwards until the tracks are resting evenly on the stairs. Make sure to coach the patient on what is going to happen and advise them not to reach out and grab anything. Both partners need to be communicating and, when ready, ascend or descend the stairs. Once you arrive at the bottom of the stairs, both partners need to slowly tilt the stair chair forward until all four wheels are on the ground. Make sure to maintain control of the stair chair while performing this maneuver. Secure the tracks by pressing down on the red bar and pushing forward on the tracks to lock them into place. Lower the top bar and make sure not to hit the patient's head while doing so. Move the lower handles into the retracted position. After lowering and retracting the handles, the stair chair can now be used as a wheelchair. Lift up on both rear handles to assist in pushing and maneuvering the stair chair. Have your partner assist the chair over any obstacles on the ground. To transport the device to and from the event, use your foot to push down on the red bar underneath the seat while simultaneously lifting the seat up. This should be done with one person on either side of the stair chair. Next is the manufacturer's video for a better understanding of operating the EVAC chair.
Welcome to our 2-minute EVAC chair virtual demo. This video is going to show you why the EVAC chair is the world's #1 stairway evacuation chair. The EVAC Chair Power 800 provides a complete stair ascending and descending solution. It can be used by a single person, providing quick, easy, and safe stairway ascent and descent. Holding the chair by the handle, lower the seat into its horizontal position. Extend the handles on the back of the chair to assist with horizontal travel, and the front of the chair to be used as armrests. For two-person operation, the front handles can be extended to aid in guiding the chair up or down the stairs. To release the tracks, use your foot to press the release pedal and tracks will glide into position. Ensure power is on and press either the up or down arrow to move the tracks in the direction required. The passenger can now be transferred to the seat of the chair. Once seated, the safety belt can now be fastened. On transferring, the occupant can self-transfer or can be transferred in line with guidance from their healthcare professional. For stairway ascent, move top handle to desired locking position. Move the chair backwards until tracks meet bottom stair edge. Then tilt chair back to the balance point until tracks meet the bottom 2 stair nosing and press the up arrow on the control panel. Keep the up arrow depressed. Allow tracks to meet their glide angle. For stairway descent, make sure the handle is locked in desired locking position. Then roll the chair to stair edge. Tilt the chair back to its balance point for tracks to meet the floor and press the down arrow on the control panel. Keep the downward arrow depressed while keeping the chair straight. Allow tracks to meet their glide angle. At the bottom of the stairs, simply tilt chair forward, using your foot as a counterbalance if needed in a controlled manner to continue horizontal travel. Once final destination has been reached, safety belt can be released and passenger can exit.
These are a few helpful tips for operating the stair chair. It will fit on the Save Mart center stairs next to the center railing. It is narrow, so be cautious and operate the chair at the lowest speed setting. It does not turn well on stairs, so it is important to line it up in the center of the stairwell. Prevent the seat belts from dragging on the ground and getting caught in the wheels or tracks by keeping them buckled. Thank you for watching this short training video. This is a useful tool that works well, but it does take some familiarization and getting used to.